Hello and welcome to Pediatrics for Mothers. Today, we'll be talking about depression in children. Depression is a serious mental health condition that affects people of all ages, including children. In fact, research shows that around 2 to 3% of children under the age of 12 suffer from depression, while up to 8% of teenagers may experience depression at some point. In this video, we'll be discussing the latest methods of drug treatment and non-drug treatment for depression in children. Depression is a common mental health disorder that affects people of all ages, including children. According to the World Health Organization, WHO, depression affects an estimated 264 million people worldwide, and approximately 3.9% of the global population experiences depression in a given year. In children, depression is less common than in adults, but it still represents a significant public health concern. The National Institute of Mental Health, (NIME), estimates that approximately 3% of children between the ages of 6 and 12 experience depression, and this number increases to approximately 13% in adolescents aged 13 to 18. The incidence of depression is also higher in certain populations, including children with chronic medical conditions, those who have experienced trauma or abuse, and those with a family history of depression. Understanding the epidemiology of depression in children is important for developing effective prevention and treatment strategies, as well as for reducing the stigma associated with mental illness. Symptoms of depression in children. Before we delve into the treatments for depression in children, it's important to understand the symptoms of the condition. Depression in children can present in different ways, but some common symptoms include persistent sadness, loss of interest in activities, changes in appetite and sleep patterns, and irritability. Children may also experience physical symptoms, such as headaches or stomach aches, which don't have any apparent medical cause. If you're concerned that your child may be experiencing depression, it's important to seek help from a qualified mental health professional. Group and based on the DSM-5 classification, preschool age, 3–5 years, persistent sadness or irritability, lack of interest in playing with friends, decreased appetite or overeating, difficulty sleeping or excessive sleeping, physical complaints, such as headaches or stomach aches, lack of energy or fatigue, withdrawal from activities they used to enjoy, difficulty concentrating or making decisions, feelings of worthlessness or guilt, recurrent thoughts of death or suicide. School age, 6–12 years, persistent feelings of sadness or hopelessness, irritability or anger, loss of interest in activities once enjoyed, difficulty sleeping or excessive sleeping, changes in appetite and weight, physical complaints, such as headaches or stomach aches, lack of energy or fatigue, feelings of worthlessness or guilt, difficulty concentrating or making decisions, recurrent thoughts of death or suicide. Adolescence, 13–17 years, persistent feelings of sadness or hopelessness, irritability or anger, loss of interest in activities once enjoyed, changes in appetite and weight, difficulty sleeping or excessive sleeping, lack of energy or fatigue, feelings of worthlessness or guilt, difficulty concentrating or making decisions, recurrent thoughts of death or suicide, substance abuse or misuse, social isolation, increased sensitivity to rejection or failure. DSM-5 classification, major depressive disorder, a child must have 5 or more of the above symptoms for at least 2 weeks to be diagnosed with major depressive disorder. Persistent depressive disorder, a child must have a depressed or irritable mood for most of the day, for more days than not, for at least 1 year, or 2 years for adolescents, to be diagnosed with persistent depressive disorder. It's important to note that not all children with depression will have all of these symptoms, and some children may have symptoms that are not listed here. If you're concerned that your child may be experiencing depression, it's important to seek help from a qualified mental health professional. Causes of depression in children. There are a number of factors that can contribute to depression in children. Depression in children can have a number of different causes, and it's often a combination of factors that lead to the development of the condition. Some of the most common causes of depression in children include, 1. Biological factors. Depression can run in families, suggesting that there may be a genetic component to the condition. Children with a family history of depression may be more likely to develop the disorder themselves. Additionally, certain brain chemicals, neurotransmitters, that are involved in mood regulation, such as serotonin and dopamine, may play a role in the development of depression. 2. Environmental factors. Children who experience stressful life events, such as a divorce, a move, or the death of a loved one, may be more likely to develop depression. Childhood trauma, such as abuse or neglect, can also increase the risk of depression. Additionally, children who experience chronic stress or live in a chaotic or unstable environment may be more likely to develop depression. 3. Cognitive factors. Children who have a negative view of themselves, the world, and the future may be more likely to develop depression. For example, a child who consistently thinks "I'm worthless" or "nothing ever goes right for me" may be more vulnerable to depression than a child who has a more positive outlook. 4. Behavioral factors. Children who engage in certain behaviors, such as substance abuse or self-harm, may be more likely to develop depression. Additionally, children who have difficulty regulating their emotions or who have a history of behavioral problems may be more vulnerable to depression. It's important to note that not all children who experience these risk factors will develop depression, and not all children with depression will have experienced these risk factors. Additionally, depression can be a complex condition, and it's often difficult to determine a single cause. If you're concerned that your child may be experiencing depression, it's important to seek help from a qualified mental health professional. Drug treatments for depression in children. Now let's discuss some of the medications that are commonly used to treat depression in children. Here's the drug and non-drug treatments for depression in children as a list, including information on some new drugs. Drug treatments for depression in children. Now let's discuss some of the medications that are commonly used to treat depression in children. Selective serotonin reuptake inhibitors, or SSRIs, are often prescribed to children with depression. These medications work by increasing levels of the neurotransmitter serotonin in the brain, which can help to alleviate symptoms of depression. Two commonly prescribed SSRIs for children are fluoxetine, which is sold under the brand name Prozac, and sertraline, which is sold under the brand name Zoloft. While SSRIs can be effective in treating depression in children, it's important to note that they can have side effects such as nausea, insomnia, and changes in appetite. Children taking SSRIs should be closely monitored by a healthcare provider. Non-drug treatments for depression in children. There are also non-drug treatments that can be effective in treating depression in children. One of the most commonly used treatments is cognitive behavioral therapy, or CBT. This type of therapy helps children identify and change negative thought patterns that contribute to depression. Interpersonal therapy, or IPT, is another type of therapy that can be effective in treating depression in children. This therapy focuses on improving interpersonal relationships and communication skills. Family therapy can also be useful in treating depression in children, as it involves the whole family in the treatment process. Prevention of depression in children. Preventing depression in children involves taking a proactive approach to promoting resilience and well-being. While it's not always possible to prevent depression, there are a number of strategies that parents and caregivers can use to reduce the risk of depression in children. One of the most important strategies for preventing depression in children is to promote a supportive and nurturing home environment. Children who feel loved and supported are less likely to develop depression than children who feel neglected or abandoned. Parents and caregivers can promote a supportive home environment by spending quality time with their children, being affectionate and responsive, and providing emotional support when their children need it. Another key strategy for preventing depression in children is to promote healthy habits and lifestyles. This includes things like ensuring that children get enough sleep, eat a healthy diet, and engage in regular physical activity. Exercise has been shown to be particularly effective in reducing symptoms of depression, so encouraging children to be physically active can be a powerful prevention strategy. Finally, it's important to teach children coping skills and resilience-building strategies. Children who are able to cope effectively with stress and adversity are less likely to develop depression than children who struggle to cope. Parents and caregivers can teach children coping skills like problem-solving, positive self-talk, and mindfulness. They can also help children build resilience by encouraging them to develop a sense of purpose, setting achievable goals, and providing opportunities for success. Overall, preventing depression in children requires a multifaceted approach that involves promoting a supportive home environment, promoting healthy habits and lifestyles, and teaching coping skills and resilience-building strategies. By taking these steps, parents and caregivers can help reduce the risk of depression in children and promote long-term well-being. Conclusion: depression in children can be a serious and debilitating condition, but with early intervention and appropriate treatment, most children with depression can recover and go on to lead healthy, fulfilling lives. As we've discussed, there are a number of different factors that can contribute to depression in children, including genetic, environmental, cognitive, and behavioral factors. While it's not always possible to prevent depression from occurring, there are a number of strategies that parents and caregivers can use to reduce the risk of depression in children and promote long-term well-being. By being aware of the signs and symptoms of depression, seeking help early if needed, and promoting resilience and well-being in children, parents and caregivers can play an important role in preventing and treating depression in children. If you're concerned that your child may be experiencing depression, it's important to seek help from a qualified mental health professional. With the right support and treatment, most children with depression can recover and thrive. By working together, we can help ensure that all children have the opportunity to reach their full potential and lead happy, healthy lives.